All right, we're live.
All right. Good morning, everyone. This is the Senate Health and Welfare Committee meeting, and it is April 28th, getting very close to May. So today we have a couple of things to complete on, actually, S-120 is the one bill that we need to really finalize our work, and we're going to get to that as soon as Jen Carby is available. We might go to it before she gets here. We have Helen Laban and Devin Green of Bi-State Primary Care and VAS respectively. So we may ask them to talk with us about the S-120 proposal. But before we get there, I just wanted to remind everyone, Nellie sent out an email this morning. Our meeting tomorrow begins at 11:30. At 8:30, begins at 8:30. We're going to end at 11:30 because there's going to be an informational session on the budget. So that will cut the testimony that we have off a little bit. So we'll try to cover everyone who's on our agenda for H225 tomorrow. And we'll talk about that bill in just a minute. So you'll also notice, I think at this point, let me let Ann in. There we go. I think at this point, Friday, Nellie, remind me briefly, because I'm not looking right at the agenda. Friday is open.
Correct, yes.
Yeah, so just keep your eyes and ears open around Friday. At this point, we don't have any topics for discussion. I had debated bringing in the DCF to talk about the residential, children's residential programs, licensure information, but I think we'll hold off on that one. That would be Jennifer Benedict from DCF talking about how the license was not renewed for Kern Hatton. But we do need to cover that, and we will. And whether we get to do it in this committee or it becomes work of the Child Protection Oversight Committee and then comes back to us, we'll see. So if you have a strong desire to look at that on Friday morning, please just let me know, because we can do that. And I think it is important for us to do that. But as I said, keep your eyes open for Friday and for information about how we're meeting, if we're meeting. That's there. Then the other thing you should know is that Friday is our last day as a committee, so morning committees are shutting down. So the email that went out to all the chairs, for some reason, my name wasn't on it. So I just found out about this yesterday. So I'm late in letting you know, but I thought it was this Friday anyway. But so we're stop meeting Friday. That allows for finance, appropriations, and other afternoon committees to complete work and to get into conferencing on important bills. The other last thing on scheduling at this point is that as we go forward and as we see bills coming back from the House, or we see changes made to the budget and sections that are relevant to us, then we will we'll just call meetings as catch can. You know, ordinarily it's easy to do when we're in the State House and we can corral everybody into a room, but it's a little harder with this. So just keep your eyes open for messages from me or from Nellie, and we'll try to stick together on this. The other thing I would ask of you each is you have each reported bills, and they're being acted on in the House. Each of us has reported bills. So as you see bills coming back to us, when they, if they get onto our calendar with House proposals of amendment, please just give a shout out let me know that you see them there, and and from your perspective as reporter, if you think we need to meet and have a broader discussion, but I'll also be doing the same thing. So we'll just try to sort out where we are with each of the bills. I know that S48, the nursing compact bill, is being worked on. I know the S20, the PFAS bill, is being worked on. S22, the stem cell bill, is being worked on. And I've had conversations about most of those with the House folks, but we'll just see what comes back to us on those. And if there's something else, let me know, please. Senator Hardy.
I think the bill on the first responder
Yep.
committee, I can't remember, is on the floor today, actually.
Yeah, on the House floor. Good. Yeah, thank you. I haven't looked to see what, if any, changes have been made. I know I talked with Representative Lippert about it. Seemed to be okay. Good. Thank you for that. All right. And any questions that you all have regarding any of the bills that you're reporting? You have ledge counsel, but I'm here if you need any, need my support. So that's it. Then what I'm going to ask you to do now, because I know that Jen is tied up on the House floor, I'm debating this one. Let's just turn, briefly to H225 as passed by the House. This bill is not, as far as I know, it has not been assigned to a committee yet. It's in rules. It came over late after crossover. But it is a bill that many people believe is important for passage. If and when the bill leaves Rules Committee, it will go to Judiciary, because it is about the legality of holding low quantities of buprenorphine without prescription. The issue for us is around the effect of buprenorphine and whether or not allowing for a prescription drug to be legal in any quantity. So that's an important question for us to consider. There's been a lot of work going on outside of the committee process to look at this issue. There may be some proposal that comes before our two committees. And it also may be that on Friday, we want to follow up with this issue. So that's all I was going to say about 225. I've worked with Senator Steers to put together his list and my list. But we have two lists, but we've agreed on some folks. I have also reached out to UVM Medical School and researchers through Jason Williams to see if we could get someone who's an expert in addiction and regulation of prescription drugs, and they haven't gotten back to us yet. But we do have Commissioner Levine for the entire time tomorrow, beginning at 10 o'clock, which is our little block of time from 10 to 11:30. So Commissioner Levine did testify on this bill extensively in the House in 2019. So in 2019, the bill was H162. And now the bill is H225 this session. COVID interrupted that, the process for that bill. So that's just a little bit of process on 225. And if you have a minute to read through the bill, it isn't long and it's not complicated. But the question for us is, how addictive is buprenorphine? It's not a street drug, it's a diversion drug. So someone gets it through a prescription, and then the prescription holder diverts the drug to someone else. So it's not a drug that comes into the state as far as we know and sold on the street the way fentanyl or other addictive drugs are. And then what else can we say about it? Well, does it promote addiction, I think is really key, because there's a lot in here about underage folks. So take a minute if you can before tomorrow and have a look at the bill. And there is a significant amount of testimony on the House Human Services webpage from 2019, and then also a little bit from this year. They just took the bill where they left it and went forward. So that's that. Okay, questions on that one? Go ahead.
Just a comment,
Sure.
Senator Lyons, that the bill did change a little in the amount that was being considered legal.
Yes, I
And
think so.
that,
Yeah. Yeah. So, and we'll look at that tomorrow and try to sort out dosage information. That's exactly why I was looking for someone with expertise in that area. So perhaps Commissioner Levine will be able to help us with that as well. Yep. Okay. All right. Senator Hardy.
I have a question about another topic, if it's okay.
Well,
don't
I
know
was
what
going to
we're doing
move
right
on to, it depends on what it is. You can ask the question.
Okay, I was looking through the capital budget because it's up on the floor today. And I didn't see the Essex mental health facility in the capital budget,
Right.
which we got testimony on earlier this session. And I was
Right.
wondering, I was planning on asking on the floor about it, but I'm wondering if you know what the plan is for that, because I expected to see it in the budget.
No, that's a good question. Let's ask that question on the floor. Please go ahead and ask that question. I
Okay.
have not talked with Senator Benning about that recently, but I'll reach out. Is that up for today, or?
I
it's
think
not?
it's up for first reading today.
Right.
And then the big bill is tomorrow.
Yeah.
So I will definitely ask him about it. It was sort of one of my notes about that bill.
Yeah, good. Do
Okay.
that. I will also reach out to him, and if I get a response ahead of time, then you won't have to do that. I'll let you know. So,
Okay.
good. Okay, good. And yes, good. I forgot. I did also look through that capital bill, and so we should each do that. All right. Good. So I'm going to ask that we turn to S120. And Jen is not yet here, but we do have a proposal that has come to us after some work by the advocates. And I'm going to ask Helen Laban and Devin Green if they're here. There you are. Good morning. Jen will be with us soon, but perhaps you could give us a quick insight into how you develop the language. And I haven't heard, I think I've heard from Sarah Teachout that this is agreeable. I've also heard that the AG and DFR are agreeable. So maybe the two of you could help us understand the proposal a little bit. First the process and then the specific proposal. Who would like to go first?
Sure. I can go first. So
Okay.
Helen Laban, Bi-State Primary Care Association. So the intent of this language change is to make it more clear than it previously was, what it was that we were trying to do.
Okay.
And let me just pull it in front of me so I'm not looking off screen. So
we have it on page 7 of our, beginning on page 7 of the bill. that Jen sent us, and here is Sarah Teachout. Sarah Teachout is here in the nick of time. So we'll also look for your comments on this proposal, Sarah. So Helen is starting off on the process and then what's here.
Right. So as discussed yesterday, I guess it was, what our basic goal is to get ahead of the national changes, or at least keep pace with the national changes that are happening around 340B participation, with actions by both the pharmaceutical drug manufacturers and the PBMs around this federal program. So we have changed the opening of that report request to indicate that there will be a report on national activity that impacts 340B participation. And we have provided an example of what we're talking about there in case we forget what was happening this time of year when we look at it again. So including recent changes to how pharmaceutical manufacturers pay rebates to PBMs for prescriptions filled through 340B pharmacies. So that is setting the overall intent of what we're looking at. And then again, as discussed in committee, we wanted to clarify that when we're talking about potential impacts, we mean all Vermont stakeholders. So that's going to be both organizations like the pharmacies, the providers and the practices, the payers, and also impact on individual Vermonters, because this is a complicated program. And by its definition, 340B is intended to ultimately benefit individual patients and Vermonters. And then we are not simply collecting this information for our own amusement. The idea is that we will outline possible state responses to these actions. And so the third component of the description of this report is to say that there will be a report on possible state responses to these actions around 340B. And we know that that's a complicated question, right? Because it is a federal program. So the example that we had of the administrative burden by Express Scripts that this legislation in bullet points 1 and 2 is addressing, that's an example of where there was a national conversation around a national action. It was determined that yes, states do have a role to play. Here's what it is. So the idea is that we are going to look forward to what those might be and anticipate them so that we are not in the situation we are this year, where we're trying to get something passed in a rapid fashion in response to changes. So that is how we are intending this report to happen, with DFR and the Attorney General's office leading that, because they do have the expertise and the national connections, again, to help inform that work. Hopefully that this rewrite clarifies the intent of this report. I don't know if Devin or Sarah have anything to add to my summary of our group writing process there.
Devin, Sarah,
Nope, Helen did great.
this is good to hear. Thank you. Devin, you're all set then?
I'm all set.
Okay, so the language that we're looking at actually is two sections, section 4, and then section 6. And the section 4 is repealed. That means that the requirements for a PBM that say shall not, that's repealed on January 1st, 2023. So by that time, then some consideration of the report that's in section 6 would be available, and the legislature theoretically could have acted next session, next year of the biennium in 2022. So that's the thinking with that. Okay, that's good. So we are going to wait until we have our Ledge Council to go through this with us, but I am greatly appreciative of the alacrity and the both the pace and the intensity with which you all have worked. We understand that sometimes these issues come up at the last minute, and we have tried to accommodate resolution as best we can in the bill. And so hopefully this will fit with us as it does with you. Oh, thank you.
Thank you. We do really appreciate you taking this up. We know it was the 11th hour, and so thank you again. It'll be really helpful.
Right, and we always get the blame for the 11th hour, but you know, this is the way.
It was
this is
us.
the way- This is the way things happen, and I completely appreciate any understanding or lack thereof, 'cause that's part of the job. So I'm going to reach out to Nellie, unless there are questions. Are there questions here for the folks who have testified before we get to Jen?
Madam
Yeah.
Chair, I don't have a question. I just want to thank you for making the language clearer. It's much better than yesterday. So thanks.
Totally. We can even understand it. That's the good news. So Nellie, I'm going to reaching out a lifeline or to a friend. Okay, good. Jen is going to be with us shortly. So why don't we take a little break? Does shortly. Okay, let's take like a 3-minute break at the most. As soon as you see Jen on the screen, then we'll come back live. And we are using our